And as you can see here, we have quite a lot on our agenda. So I think we'll forge ahead. So I'm Louise. I'm one of the steering members of Washington Indivisible Network with Robin and Kat and Kevin, who's on vacation. And I just want to welcome you all here tonight. Thank you so much for being here. We have a couple of wonderful speakers tonight that I think we'll all learn a lot from. So I'm looking forward to hearing from them. First, I'll start with a land acknowledgement. There are over 30 tribal nations here in Washington state. The land I occupy today is the traditional home of the Coast Salish, Snoqualmie, Stillaguamish, and Duwamish peoples. Without them, we would not have the access to this beautiful working, learning, and living environment. I express my genuine gratitude to the caretakers of this land who have lived and continue to live here since time immemorial, and acknowledge that we have benefited significantly from the careful and intentional care they provide that continues to protect and preserve our natural resources for present and future generations. I acknowledge that they are the rightful stewards of the land. This acknowledgement does not take the place of authentic relationships with Indigenous communities, but merely serves as a first step in honoring the land I occupy and resisting the erasure of Indigenous past, present, and future. So first up, we're going to hear from our soon-to-be former regional organizer, Nina Moussavi, who has a few things to share with us.
Everyone. So yes, I am officially the former organizer. I just have two things I wanted to share. The first is that we have hired on the new organizer in the state of Washington. Their name is Hannah Oliver. I will be doing an email introduction on Wednesday evening for all of the Washington group leaders with Hannah. And then Hannah will provide their link to, I think they use Calendly, so that you can start scheduling one-on-one meetings with them and introduce your group, introduce yourself and the work that you all are doing. Hannah just started, I think maybe 2 weeks ago, and I have just recently been able to do some transition work with them for taking over Washington. Hannah will also have Oregon, so I'm hoping that you all can do some cross-state work a little bit easier since you'll share an organizer, especially thinking about the work that you all are doing down in Washington's 3rd district. I know that there's a lot of overlap for some of the local work that happens there. So keep your eyes open for that email. I will still be around if you have any questions or need anything. The onboarding process at Indivisible is a little bit extensive, so it can take a couple of weeks. So please be patient with Hannah as they're finishing the onboarding process. And there will definitely be a bit of a learning curve from what you're used to in terms of like the level of knowledge I have about Indivisible versus the level of knowledge Hannah will have, purely because they are new to the organization. So please show them just the immense respect that I know that you will, and welcome with open arms. And I will still be at the statewide gathering in September, so I'm really excited to see everybody there one last time and helping Hannah out. And then the second thing I wanted to just share with everybody, we are launching our Powering Progress campaign this week. I'm putting in the chat box the information for the launch call. This is our campaign that actually celebrates all of the tangible benefits of having specifically right now we're working on the Inflation Reduction Act, but in general about having a Biden White House and having Democrats and progressives in control. So we're asking folks to spend the month of August finding ways to celebrate that in your community by tabling or attending community events, county fairs and things like that, and spreading those tangible successes that you all are actually seeing as a direct result of of the Inflation Reduction Act. So the call on Thursday, our launch call on Thursday at 5 p.m. Pacific time, will have a lot more details for you on what the month of August will look like and what resources we'll have available. And then Hannah will be available to you as you are planning those events. And that's all I have. I hope I kept it under a couple minutes, and I'll stay on for the next like 15-20 minutes. If anybody has questions, you can put them in the chat for me.
Thanks, Dana. Great to see you. So our two speakers tonight, we have Alan and Vocki from Indivisible Greater Vancouver, and then we have Cindi Bright following them. And to introduce Alan and Vocki, Alan is a healthcare policy expert with Indivisible Greater Vancouver, and his partner Vocki Hovagimian have advised the League of Women Voters and the now author an outstanding daily blog about healthcare on Substack. So I'm going to stop the share, and Alan, if you need to share your screen, you should be able to.
Oh, I'm busy talking. Thank you. Thank you, Louise, for having us here. Let me just blow this up. And let me point out, Louise has these slides, and I would be grateful for her to share them with all of you because they're loaded with links that are really important. So what we're going to talk about is the healthcare crisis in the United States and what to do about it, because there are a lot of different solutions. So this is my wife, Vocki. I'm Alan. For more than 100 years, there have been active movements in the US to increase access to healthcare, starting in about 1912 with Theodore Roosevelt. Sadly, there have always been people who stood in the way, who sought to restrict or deny access for political and/or financial gain. The health of our nation is far too important to trust to those whose main interest is not our health. Single payer is one way of implementing universal health care. It's essentially a single insurance trust. It is a public insurance trust to pay private providers. Now, if anybody stops you on the street and screams, that's socialism, you can just scream right back and say, no, it's not. The government's only stake is to be the insurance company. They don't moderate, they don't direct the traffic. Everybody continues to choose their own providers. And that's pretty much what we're talking about here. So let me encourage everybody, if you have a question, stop me anytime. The US healthcare system is in crisis. We have 27.5 million people in the US with no health insurance. 46.5, age 19 to 64, are underinsured. That is, they have some kind of insurance, but it's usually a high deductible, limited policy. We used to call those critical or emergency policies. We have almost 400,000 medical bankruptcies every year. I want everybody to note that our 35 industrialized peer nations have none. 10% of the US population, adults, have medical debt in collection. 250,000 GoFundMe campaigns every year, raising about $650 million only for medical expenses. We have rising premiums, co-pays, deductibles. They all limit access to healthcare. And if you're not sure about that, the Rand Corporation did not a study, but they actually did a real experiment in 1994, and they found that increasing co-pays 2% resulted in a 10% reduction in the use of healthcare. So this is a cultural thing in the United States. If you make it cost more for us, we won't use it. In other countries, it's not that way. France is exactly the opposite. If you charge in France, people think they're getting something of value, and so they go. Here, we're different. This is one that, this next statistic is particularly egregious. There are 336 out of 100,000 deaths every year in the United States out of every 100,000 in population. 336 people die who don't have to. They either die because they didn't get access to health care or because the public health care prevention system failed them. This is not good. So I'm not only interested in the social good for all of us, but none of this is going to work if business is not on board, because they are such a driver in the healthcare system. Health insurance typically costs a business owner 15 to 18% of payroll. It is hard to compete worldwide if your costs are 18% higher than your competitors' costs. It's hard for Ford to compete with Toyota when Toyota doesn't pay for healthcare. There are some businesses in our area here in the Pacific Northwest who have a tremendously hard time finding an insurance carrier for their businesses. They want to have business insurance. They want to have insurance, health insurance for their workers because it helps draw better employees in. Sometimes there's only one provider in their whole county. Eastern Oregon is like that. A lot of the insurance providers have just dried up. They said, we don't want to service the area, and they left. Part of the problem we have is that 55% of us get our health insurance through work. Employees often stay on the job just to have insurance. I know people that do that. During the pandemic, if you lost your job, you lost your health care. And we saw what a devastation that was. Unions, we've met with any number of union leaders, and they complain about this all the time. They hate wasting valuable bargaining time just to negotiate healthcare benefits. There are so many more things they want to do that are more important for their for their members. They have to waste time on benefits. Okay, what else is going haywire? As a country, we pay more for healthcare than anybody else in the world, not just per person, but as a percent of GDP. We have a lower life expectancy than our peer nations by at least 3 years, and this is particularly bad. Our life expectancy is dropping while theirs is increasing. I have slides on this in the back. We can go to them anytime you want, or you can peruse them at will. But everybody's life expectancy started to drop in the pandemic time. Ours did too. Most of Europe and other countries with universal health care, theirs have gone back up. Ours continues to decline. I mentioned the deaths amenable to treatment. 70 million of us are uninsured. Did I mention maternal health care? Oh, let's do that one. Okay, so this is bad. This came out last week. Maternal mortality, there aren't that many women that die related to childbirth in the US. It's about 1,208 last year. But that's 1,208 women that most likely didn't have to die. Maternal mortality is measured in deaths per 100,000 live births. And the US currently stands at about 39 deaths per 100,000 live births. White women are at 26 deaths per 100,000 live births. Black women are at 69 deaths per 100,000 live births. If you don't think there's a racial component to healthcare, there's the evidence. Now you might say, okay, the interesting numbers. What does Europe look like? Germany is at 4. France is at 8. Japan is another universal healthcare country. They're at 4. Most of Europe is in the 3, 4, 5, 6, 7s. We're at 39. We got a problem. Okay, how do you fix it? The answer is there are 2 things that fix it. One is having access to healthcare, and the other is making sure that providers are available and that they're paid for. Single payer does this. I don't know if you guys have read it. These are actually active links to each of the bills at congress.gov. I encourage anybody who wants to go and read them. The House bill was put forward by Pramila Jayapal up in Seattle, and the Senate bill is Bernie Sanders. They cover everyone, cradle to grave. They are comprehensive care. They include preventive care, prescriptions, dental, vision, hearing, behavioral health, and long-term care. There are no deductibles, no copays, no pre-authorizations, no limits, and you can read a whole summary of all the benefits there. You might be wondering, how the hell can you do this? What's going to make this possible? And the answer is the congressional budget was asked the same question in 2020. And they evaluated 5